I'm Dr. Joseph Longo. I'm a board-certified orthopedic surgeon in Scottsdale, Arizona. Been practicing for 30 years. My specialty is primarily adult reconstruction, including total joint arthroplasty of the shoulders, hips, and knees. I've had a tremendous trauma experience prior to evolving into a joint reconstructive surgeon. Well, throughout my years, I've been involved with a lot of training of residents, fellows, fellow doctors, scrub techs, nurses, and engineers, and I find that SurgiSTUD is a great alternative that increases the capabilities of training, education, practicing for all of these groups. The cadaver world has been primarily part of that process in the past. It's expensive, it's hard to repeat, it's hard to have an ongoing training session with it, and it's limited as far as its capacity as far as training for broaching and the real feel of bone. You're at the limits of what that has to offer. SurgiSTUD has a great alternative approach where we can modify, customize implants, modify models to test implantation in a variety of ways in a more consistent fashion. It also allows for repeated use in a more economical way. It also, in this world of ours, allows us to use it in an office as an approach in a van, in a hotel room, in a safe manner. It has also bypassed anything that sawbones in the plastic world has to offer. Plastics in a sawbone maybe just demonstrates a model of a fit of an implant, but it really doesn't allow for the technical expertise or the teachings and trainings, and it doesn't really typically have excellent soft tissue attachment to it. So SurgiSTUD has really enabled a whole new world, really, of training and hands-on approach to learning and educating all the people that are involved and need to be involved with our orthopedic industry. As I've mentioned, I think the cadaver are quite limited. They're expensive. There's risks for infection. They don't hold their muster after a while. I mean, you can't really revisit them the next day. Whereas in SurgiSTUD, you have repeated use. You can come back and approach it in a different way. You can rebroach. The quality of the tissue is better with the SurgiSTUD as far as bone representation. I can make it osteopenic. I can make it hard young bone, and I can practice in different techniques related to that. Whereas in a cadaver, this is what you get, and it's one thing. You may not have appropriate anatomy. The soft tissues tend to desiccate pretty quickly, macerate, whereas the SurgiSTUD has a much more reliable, repeatable model to use. From an engineer's point of view, this allows them possibly to quick think tank different modifications on their either instrumentation or their implants or broaches and modify it quickly rather than trying to do an expensive, unpredictable cadaver performance. I'll start with the engineers. When you're first developing the implants and the protocols, you really need a predictable way. Usually it's garnished by a couple of educated surgeons on trying to have input on what's clinically important. This then allows them to go to that input from an engineering point of view and quickly adapt or modify their instrumentation or their broaching based on a model that's predicted by clinical practice. So that's an awesome thing that really is difficult to do. 3D finite element analysis does a little bit, but it's not a hands-on approach. This gives a hands-on approach to the engineers and the developing surgeons to develop products and techniques and modify instrumentation for that as well. Second thing, it allows them to train their sales staff and their reps as far as what the techniques are on a very hands-on approach. So they know the problems, they can troubleshoot it hands-on, which is the best way to learn, and to use their own products on that. So internally, it's a marvelous way, relatively inexpensive way to adapt and train multiple facades of that industry approach. Also, the benefits of SurgiSTUD is that you can take a customized approach. If you have a really complex alignment, whether it's a varus knee or a valgus knee, you can reproduce that and train specifically for that model. And the same thing with bone quality. It gives a feel of the bone that's so realistic, it would help in training as far as trying to broach, for instance, a femur. It gives a repeatable size of a femur that you can come in and practice different techniques as far as broaching and implantation to train a surgeon or a rep or a young surgical scrub on what the appropriate technique might be. It's definitely worth the amount of usage. As I said, I can do on a total hip, for instance, I can do a posterior approach, a lateral approach, and an anterior approach all on the same model, and it's going to stay there the next day if I want to revisit it. I can repeatedly re-implant the bone and modify my techniques on the same model. There's no risk of degradation or contamination. I have the model also to explore afterwards if I wanted to double check on what the anatomy is doing nearby. In a complex case, I have the model to revisit. Yeah, I think this is a beautiful way to do that because you can do practice this right in your office or at home or at a local facility. There are ways to carry this on board with a online approach, almost a Zoom meeting type approach for questions and answers. Could be visually demonstrated quite easily on camera and have a model right on your hands to duplicate at the same time. It's really quite an extraordinary way to carry forth our training. Yes. The other aspect is the feel of the bone is quite true, and you never quite get that with the cadaver. So the things that we do as orthopedic surgeons with hard tissue, particularly bone, is we ream, we broach, we drill, we saw, and we cut. We cut with, and you also have to have enough structure to the bone to hold a good retractor, and sometimes the mush of a cadaver doesn't allow that. The beauty of this is these hard tissues can be duplicated in a consistent fashion across the platform. So if you're training multiple surgeons, you can have the same quality bone, the same size for everybody there to learn a platform, whether it's a specific instrumentation as far as broaching, because surgeons like to have a true fit and a feel of broaching. We don't get that from a plastic saw bone. We don't get that really in cadavers because they're not consistent. This gives a true feel of a hard bone for a young person or a softer bone for an osteoporotic, and you can dial that in. The same thing for the use of robotics. You have a consistent model that multiple surgeons can practice on the same approach with the same instrumentation, the same model as far as the robotics are that are introduced to it. So I think this facilitates a lot of consistent training, which we don't really have. We have it like monkey see, monkey do, but we don't. If the cadavers are all different, you're not really getting consistent results or consistent feel. And so surgeons sometimes are not sure, well, how is this going to feel on a patient?